Robyn Flynn filling in for Elias Makos all this week. The Association des Médecins Juifs du Québec are working on some initiatives to combat antisemitism in the medical profession right here in the province of Quebec. They're planning to develop an anti-Semitism curriculum specifically tailored to Quebec's medical faculties. Now, this curriculum comes as the government announced the creation of a new educational program to fight anti-Semitism. Here to talk a little bit more about that is Dr. Lior Bibas, Vice President of the Association des Médecins Juifs du Québec. Good morning, Dr. Bibas. Thank you so much for being here.
Hey, good morning. Thank you so much for having me.
Now, when we talk about anti-Semitism in the medical profession, what are we talking about? Are we talking about, anti-Semitism directed at patients, directed at staff and doctors and medical professionals? What do these incidents look like?
So, thanks for your question. So, anti-Semitism, just like we have seen in society, not only in Quebec, but the rest of Canada, has really grown since the events of October 7th. And we formed after seeing what happened on October 7th and kind of expecting that there would be a rise in anti-Semitism. And initially, when we formed, our goal was really to protect our trainees. As you know, medicine, there's a hierarchy to the system, and trainees are kind of at the bottom of the totem pole, and we wanted to make sure that they have the safest environment in order to complete their training. But since then, we've had numerous plentiful anti-Semitic incidents, from inappropriate social media posts, sometimes made by attendings or program directors, a few incidents of verbal abuse and intimidation, microaggressions, guilt shaming, people wearing certain signs that symbolize the destruction of Israel. We had trainees coming to us with high levels of anxiety before working with certain colleagues. And I think also we're in a unique position because as physicians in Quebec that are Jewish, we're also part of, in one hand, we're part of the physician community, but we're also part of the Quebec Jewish community. And we know that even some patients have had certain concerns. They check social media posts of their physicians before going, and then we've gotten some patients asking us, should I still go see this physician after they posted this? So I think we're kind of in the middle of our own community, but also the Quebec community at large, and our role is really to first of all improve the safety of physicians in Quebec, and also make sure that our patients feel safe, whichever environment there are. There's no rule. It's not just anti-Semitism. At the end of the day, there's no rule for any form of discrimination in medicine and beyond.
Exactly. I think a lot of people probably don't realize the fact that we even have the Jewish General Hospital in Montreal is because of anti-Semitism, right? Like, doctors who were Jewish were not being hired, so a hospital had to be formed, if I'm not mistaken,
it's
right?
It's interesting that you bring that up because in 1934, so it's going to be 90 years, there was an incident with a Jewish resident, a physician that's from Montreal, an Anglophone who did his training in Montreal, in the States, and went back to Montreal, and it was supposed to work at Notre-Dame. And at the time, it's crazy to think that this happened, but residents put on a strike and refused to work with him. And, that kind of started the process of forming a Jewish General Hospital, which still is, a huge point of pride for our Jewish community. I think another point of pride of the Jewish community is that it's able to serve all patient population, regardless of creed. And but now today, there's Jewish physicians, Jewish patients going to every single hospital. So our mission is throughout healthcare, really.
That makes a lot of sense. In conversation with Dr. Lior Bibas, Vice President of the Association des Médecins Juifs du Québec. Now, when we talk about this new curriculum that is being developed, what does that curriculum entail? Will this be presented at the university level? How is this going to be implemented?
Our goal is really, first of all, to work with faculties, universities, and hospitals in order to render these hospitals safe and kind of get rid of anti-Semitism and address it properly. Our goal is to meet with them and to propose to them educational modules built by experts, but with also our consultation, because, we feel that as physicians, things are sometimes different. Look, medicine is unique in the sense that it's not just in the hospital, it's also in the universities. We have our students that are still in the university, some that are half and half, and a lot of physicians are also faculty at universities, but also work full-time in hospitals. So we definitely want to address it both in both places. We're currently working on it, and our goal is really to work with leaders the same way they work with leaders of other discriminated populations in order to find ways in order to address anti-Semitism and really make sure that that Jewish physicians and Jewish patients are safe wherever they consult.
Now, if somebody finds themselves in a situation where they feel they've been a victim of anti-Semitism, are there places where they can turn for support to file a complaint? Does that infrastructure already exist?
Yeah, so, our Jewish community here is, hundreds of years old, and it's been pretty established. We have a lot of community partners that we work with. In general, I would say that when there is anti-Semitism wherever at large, there's organizations like Bibas, CIJA that are able to help out. We tell all our members, so we have more than 450 members. We think there's about 200 more physicians we could get. By the way, we are also open to non-Jewish physicians that want to join as allies. We tell our members, if there's anything, please reach out to us because first of all, we want to be aware of it, but we also want to allocate. We could tell them, okay, well, you should go to this place. You should direct to this person. So that's how we're helping them right now.
For more information about this curriculum and the work that the Association des Médecins Juifs is doing, is there a website or a place people can go for more information?
Well, right now we're really working on it. We're a nascent organization. We have a lot of different things going on at the same time. This is a real priority for us, and we're working hard on it. It takes a few months. We are, there was it was in La Presse, the program that of education that was launched. We are working with the same people, but also we want to really adapt it to the healthcare. We think healthcare is different. It was also a program that was done out of Canada. We want to make it specific to the Quebec healthcare. There's the English Quebec healthcare, and then there's the wider and bigger French Quebec healthcare. There are differences when you work in both settings. I've worked in both settings, and despite them being sometimes a few kilometers away, there are differences in the culture and the way people work. So our job is to really adapt it for the healthcare setting, both university and hospital.
Dr. Lior Bibas is Vice President of the Association des Médecins Juifs du Québec. Dr. Bibas, thank you so much for your time.
Thank you, and have a great day.